last but not least, it is my pleasure to introduce Victor Chong, who's going to be talking to us about subliminal laser for age-related macular degeneration. Victor, take it away.
Right. So we're talking about subliminal laser for macular degeneration, in particular for drusen removal. And this is my financial disclosure. Other than being a consultant for Quantel, it was not relevant. Removal of drusen by laser is not a really new concept. It has been something that discussed more than 25 years ago. And it was really founded by the observation that drusen disappear after laser treatment for diabetic macular edema. And even back in the long time ago, that you can see the picture of soft drusen on the screen there, and we can see the autofluorescent imaging that's showing the blockage of the fluorescent by the drusen. And the trial in Moorfield is way back in 1995, and this is over 25 years ago. And at that time that we are doing just 12 spot of laser around the central of the fovea. As you can see in the picture down there, that the drusen disappear, but the laser is barely visible, if actually visible in the fundus photograph. However, that when you do autofluorescent imaging, you do see there is some RPE changes there. And this is way back in 1995. And without, unfortunately, that it wasn't, say, success, that it didn't really show any benefit other than drusen disappear. At roughly the same time, the CNV prevention trial are also considering doing the similar thing. That was obviously before the publish of the Moorfield trial. And they're using a pattern called the laser 20. So instead of doing just 12 spot, you do a lot more spot as such. And again, that you can do the mirror image after 6 months, so you can get the whole posterior pole treated. Again, the rate of CNV was actually higher than the one that was not treated by the laser. However, that if there was no CNV, that the drusen reduction occurred in the laser treated group, and also the visual acuity was better. Bearing in mind that although that is unacceptable to think that the CNV rate is increased, but over 1 year, the CNV rate is actually still very low. This has been going on for some time, and then at that time, that what we know was drusen disappear after focal laser, and increased risk of CNV do occur, which obviously is not a good thing at all. And however, that when there's no CNV formation, less drusen and vision improve. So this was followed on by another study called CAPT. Now there's a little bit different here. This time that in the CAPT, they use a diode laser, and they also use a subthreshold intensity. However, that Dr. Wu mentioned earlier that what is subthreshold, what is subliminal or micropulse. I want to clarify that point here. That's subthreshold, meaning that you just can't see it during the procedure, and doesn't necessarily means a subliminal or micropulse. And subliminal and micropulse is the same thing. It's important to make that distinction because that when you're reading a literature that in the CAPT, they were talking about subthreshold laser, but it was doing it in the conventional way, and therefore that they still have an increase of CNV. So this has been all done, more than 20 years ago, and people kind of stopped doing that because that it doesn't seem to be effective. Until more recently, that the selective retinal therapy, the 2RT laser, but led by the Australian group, has actually demonstrated there is some possibility of drusen potential preventing of geographic atrophy formation, not necessarily CNV formation. And the 2RT laser is a double frequency YAG laser, but with extremely short duration, with about 3 nanoseconds. And they claim to target the melanosome and actually have less collateral damage. And but when you're actually looking at the experiment, that the cartoon was shown that it seems to supposedly that the laser will target the individual RPE cell. But in the publication from their group, show something very different. As you can see in picture B there, that not just a single RPE cell, but the whole spot size of RPE cell is damaged. However, that it is possible that RPE cell is damaged, but not necessarily means that the retina on top is affected. And indeed, that when you're looking at the using a 2RT laser for drusen removal, you see the RPE changes, but then the photoreceptor layer appears to be intact. And similarly, that when you're actually doing microperimetry on top of those areas, despite the RPE cell seems to be affected, but then the photoreceptor seems to be intact. Now the question is whether is that the retinal on top is important, or whether that the RPE damage is important. And certainly that back to what we know from some years ago, that when you can't really see the changes, but you can actually see the RPE damage, that actually lead to the breakdown of the Brooks membrane, and actually that leading to the wet AMD formation. And indeed, when you want to create a CNV in a mouse or a monkey, and what you need to do is to shoot a laser and then to create a break in the Brooks membrane. So I wasn't surprised that in the old days that can happen. The question here is that if you are using the 2RT laser, you disrupt the RPE cell that you can see. You didn't seem to damage the retina, which is a good thing. But whether the Brooks membrane is damaged or not is unclear. So going back to what we were discussing earlier, was a threshold to me is just no visible reaction while you're doing the laser. Subliminal is slightly different. We already talked about several times. That is actually on using the on and off time to show whether the power is actually get through the RPE cell. But in fact, that from multiple studies have shown not only the photoreceptor is not damaged, similar to 2RT laser, but even the RPE cell itself doesn't seem to be affected. And which obviously that is a potential benefit, that if the RPE cell is not affected, the chances for the Brooks membrane to be affected are even less likely. So the question is that whether that would be able to get rid of drusen. So again, we show you a couple of cases. That is one that we did some years ago that we're trying to doing a pilot study to look at this drusen removal, as you can see here, that before and after. And we treated a very small area because it was just a testing experiment, but it did show that some of the drusens do disappear. And we are also share that information with our Chinese colleagues. And as you can see here, there is another patient that was treated in China. And you can see that there was no laser scar. It was treated in the subliminal way that we have been talking about using a similar protocol, and we discussed it before. And you can see that quite a large number of the drusen disappear. And at the same time, that when you look at the OCT, the top is before the operation, and then the bottom is after the laser. And you can see that the drusen disappear, and you can also see that there is the RPE cell is intact, but more importantly, the photoreceptor on top also appears to be intact with the intact EC layer. And you can see that the drusen seems to just disappear, and without apparent damage to the photoreceptor, RPE, or the choroid. So the question comes to who should we treat? Well, I think my opinion is we think that large drusen is essential. It seems to the large drusen seem to respond much better to the laser treatment. The hard small drusen doesn't seem to be, but probably they come with different pathology. We aim is to try to improve the patient's low luminance visual acuity, because a lot of our patients with dry AMD, that they will tell us that they can't read, despite that they might have 20/20 vision. And one of the main reasons is actually they got a low luminance visual acuity deficit. and actually because the contrast sensitivity is much reduced. So I think that those who got low luminance visual acuity deficit might be the targeted patient because you might be able to improve the visual acuity to improve the reading speed. Do we need CNV on the other eye? Well, if your purpose is not to try to prevent CNV, then obviously you don't. And again, at the moment, it's really not clear whether laser removing drusen can prevent CNV. And indeed, that in the 2RT laser, they specifically excluded patient with CNV in the fellow eye. Should we exclude a patient with atrophy? Again, this is something that we're still working on. If you had a small area of atrophy, which is not in the same area of drusen, why don't you still want to treat the patient? And again, this is something that the 2RT team have excluded because they want to use the onset of geographic atrophy as an endpoint. So again, it depends on how you want to run the study. In the 2RT study, shown that when you got pseudoreticular drusen, they are actually more likely to have atrophy for those who are treated. So again, whether we should exclude pseudoreticular drusen is another something that we need to look at and understand. So finally, that I don't want to say that we can draw a conclusion, rather than I can share my view on a discussion. I think a drusen removal is definitely possible. We have case series that can show that. However, the control trial is probably needed to demonstrate efficacy to see whether we can improve low luminance visual acuity. We see whether we can prevent the onset of geographic atrophy and wet AMD, and also that to see whether we can slow the progression of geographic atrophy. And we were a bit unlucky that we were just about to start our trial in the Royal Free Hospital in London, and then we hit by coronavirus, and then all our these not major interventional trial have been stopped. But we hope that we can actually start the trial in the near future. Thank you very much for your attention.
Thank you, Victor. That was excellent. And with this, we will conclude the symposium on subliminal laser. Once again, I'd like to thank all my fellow speakers and Quantel Medical for the opportunity.